The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With me this morning is my co-host, Vin Martello, our Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. How are you today?
Thank you.
Dr. Smith, today we have a great topic and a very special guest. And we're going to be talking about the Health Alliance Westchester Medical Center Health Affiliation, where it came from, where it's going, and what it means for our community. And our guest is David Scarpino. He's President and Chief Executive Officer of Health Alliance of the Hudson Valley, which runs 2 hospitals in Kingston and is Ulster County's largest employer. I should note that Ulster County Department of Health and Health Alliance have collaborated in many areas over the years, most notably in working together along with other community partners to advance County Executive Mike Hines' goal of making Ulster the healthiest county in New York, and we've enjoyed great success with that. And then most recently, in the preparation of the Community Health Improvement Plan for Ulster County, which is part of the overall New York State prevention agenda. Health Alliance is marking an important anniversary. This is the 1-year anniversary of its affiliation with the Westchester Medical Center Health Network, known as WMC Health. You might have seen the signs and the new logo around. And on this 1-year anniversary, we're here with Dave Scarpino to look at what the affiliation has meant and what it will mean for Health Alliance and the people in our beautiful community. Welcome, Dave Scarpino. Dave. How are you?
It's great to be here. Thank you for inviting me on this nice Sunday morning.
Dave, if you will, take our listeners back before the affiliation and talk a little bit about what were the challenges and opportunities that you saw that caused you to pursue an affiliation, and why Westchester Medical Center?
Sure, Vin. That's actually a great context for everything we're going to be talking about. What we saw in actually 2012 was a shrinking financial bottom line. We saw shrinking volumes, and we had 2 hospitals, and we knew fundamentally that we needed to consolidate to a single campus. That was first and foremost. Number 2, we also saw healthcare moving in a different direction. It was moving away from volume. And back in the day when I was a chief financial officer, everything we looked at was related to volume. How many people were in beds? How many ER visits in a day? How many lab tests did we do? But the world started to change, and we looked to value rather than volume. And by value, I mean, how do we keep people healthy? How do we keep them out of the hospital? By definition, when you do that and you're successful, the hospital footprint shrinks. And therefore, the need over time to get a smaller and smaller inpatient hospital, but a larger and larger medical perimeter.
Right. That happens with a lot of government agencies, right? They're created to address a certain problem. As that problem diminishes, now they're essentially slowly putting them, decreasing their business.
You're right, and we were challenged with a really a paradox of sort of how healthcare works. Healthcare is designed historically to pay us on volume. That's how we get paid. So if we, in a vacuum, reduced volume, it would be to our detriment, because there would be no corresponding revenue to kind of compensate for that reduction. Along came the opportunity with the state of New York to develop some value-based programs where there would be what they call replacement revenue. We would get paid based on metrics of reducing hospital occupancy, reducing hospital footprint, and being able to invest that money in an outpatient program.
Right. And I know that some of the private practices have consolidated due to their own financial considerations and pressures and leverage with insurance companies. So I noticed that they also began to eat into some of the former profit centers and some of the specialty services.
Right. That's also part of our challenges. It's not a level playing field in healthcare. And by that I mean that private physician practices are individually and separately incented to remove volume from the hospital. So we're paying the doctors to take business away from us. You're right. Mm-hmm. So they're actually in competition with us. Mm-hmm. So we've got to work with the physicians, knowing that it's a competitive environment. And the reason we looked to WMC Health and Westchester Medical Center is we knew we needed a big partner. You cannot operate in this business anymore by yourself. You can't be a standalone hospital. So everything that a large affiliation brings to us, we've enjoyed so far. So for instance, better negotiating leverage. The ability to leverage some of the contracts they've negotiated with suppliers of goods and services, the ability to bring physicians to the community. There's many, many things that an affiliation brings to us, and we can get into that a little deeper later.
Mm-hmm. Yeah, I'd actually like to do that. Sure. I noticed in some of the notes that your folks sent over, you talked about things like improving patient satisfaction, attracting more physician specialists, technology, financial stability we talked about already, obviously, and clinical best practices. Can you give us some examples? Say, let's start with patient satisfaction. How will that work?
So part of value-based purchasing, we have great acronyms in this business. One of them is called Value-Based Purchasing Quality Enhancement Programs, as we call it VIPQUIP. Gotta love this stuff. Sometimes you need a dictionary to have a conversation. Part of that payment stream that we will be receiving is based on patient satisfaction. So, for instance, a patient comes into the hospital, and think about this. This is apart from quality. Did we improve your health? Did we treat you in a way that you got better? Forget about those for a second. They're very important. But from a patient satisfaction point of view, was communication between nurses and patient effective? Did you understand what your doctor was telling you? How was the food? Was the environment quiet? How was your pain? Those are all patient satisfaction drivers. People judge a hospital by those drivers. Tend not to focus on the quality. Did you get better?
Right. The experience.
The experience. So if we're going to get paid based on improved patient experience, then we need to address the issues that surround that. So for instance, is it quiet? Having two people in a single room, especially with the population that we serve. The population that we serve tends to be elderly, tends to have behavioral health underlying issues, and two people in a room tends to be noisy. You're having families coming in, you're having practitioners coming in. The ability in a new consolidated hospital to have private rooms is an immediate patient satisfier. Mm-hmm. We're working with Westchester, and here's how we bundle two different leverage opportunities. We're negotiating with Westchester right now a food service vendor, and part of the compensation to that vendor will be outcome-based. Did the patient satisfaction scores improved? An opportunity to lower cost and improve patient satisfaction.
Right, creating a win-win scenario.
It's a win-win for everybody.
Now, with respect to physician specialists, does that mean, in terms of attracting more physician specialists, does that mean they'll actually be here, that they'll be here on a telemedicine basis, that they'll have access to them? Exactly where does that fall?
All of those are yes. Uh-huh. So the number one is identifying throughout the system where we have deficiencies. And by deficiencies, I mean we have shortages of certain specialties. Identifying what those shortages are, and then with Westchester, being able to recruit them. So this is predominantly WMC Health hiring these physicians and then bringing them to our community. Mm-hmm. We do it either on a solely here or shared basis with Mid-Hudson Regional. So when we look at Mid-Hudson Regional, we're really developing a northern strategy. How do we take a look at shortages in Kingston and in Poughkeepsie and bring specialists to the community that we share? So right now in Lake Katrine, we've got 8 brand new proceduralists, specialists that we're sharing with Mid-Hudson. So we've got now 2 neurologists, 2 neurosurgeons, 2 vascular surgeons, an oncology surgeon, and a general surgeon. Those are folks that are new to the community, are filling gaps in service, and they're doing business right now. They will see patients, they will do procedures in the hospital. What that means to us, number one, it's good for the community, because patients in the community no longer have to travel outside of our community for the care that they need. Number two, it allows us to keep people here from a revenue stream point of view. We have a lot of leakage to other surrounding area hospitals because people just don't have the services they need. So they have to travel to Albany or across a bridge. So we're closing that gap. The second thing that we're looking at is telemedicine in really, really hard specialties to recruit, psychiatry in particular. So you take a look at psychiatrists and how hard it is to get psychiatrists in a community. All over the country. Absolute. That coupled with a really growing behavioral health population that we serve, and coupled with an opiate addiction population that we serve, it's probably one of the things that probably challenges us the most. Westchester has the uncanny ability to hire and retain psychiatrists. So we married two things. We married, actually three things. We married need in the community. We married Westchester's ability to hire psychiatrists. And we married technology. Westchester has a very robust telemedicine program, and we're able to bring right now both inpatient and outpatient psychiatric services via telemedicine. And very successful, by the way. Patients not only receive them warmly, they enjoy it. And the younger the patient, the more comfortable they are talking to somebody on a screen. Mm-hmm. Think about our adolescent program. It's part of their culture.
Right. Now, outside of the behavioral health realm, do they also, in terms of telemedicine, do they actually do things like assist like physicians on site with diagnoses and examinations and recommendations?
So if you're in the psychiatry arena, it's really talking to the patient one-on-one. Mm-hmm. When you're dealing with stroke protocols, you're dealing with neurology, you're dealing with ICU patients, even neonatology, they're really assisting the physician on the ground. You're able now to bring in an expert at Westchester Medical Center who sees maybe an underweight baby who has early onset issues due to birth. That's somebody who sees this every day, and our doctors don't. You can bring them in via telemedicine, and they can help and assist that physician through the episode. Mm-hmm. It's very, very powerful stuff.
That is excellent.
Yeah, and I guess it gets into the next point on clinical best practices are shared in that way, right? Because you have so many top-notch people working, collaborating that the best information, best procedures get out there.
Right. So you're right. So it improves your best practices, but what it also does, it allows then a collaboration between a Westchester-based physician and a community-based physicians, and if in their opinions a patient needs a higher level of care, the care is already coordinated. It's coordinated on the ground while they're still in the bed in Kingston or even in Margarettville, and then they could be immediately transferred down to Westchester without really seamlessly.
That's really great. And we want to find out a lot more about all this, but right now we're going to take a short break, and we'll be back after these words. You're listening to Healthy Ulster Radio, and we have Dave Scarpino from Health Alliance.
In emergency care, it's all about experience. At Health Alliance Hospital Broadway campus, a member of the Westchester Medical Center Health Network, it's another way we're investing in you. We're board certified in emergency medicine, nationally recognized in stroke care, and use telemedicine to give patients access to the region's leading specialists. Patients tell us we make their experience exceptional by treating them with the utmost respect. Health Alliance Hospital Broadway campus. We're advancing care here. Visit hahv.org for more.
Welcome back. You are listening to Healthy Ulster Radio. Our special guest today is Dave Scarpino, who's the president and CEO of Health Alliance Westchester Medical Center. Dave, we've been speaking about many of the innovations that are starting to happen in our community thanks to this affiliation. We've recognized for a long time that rural communities do have a harder time having their populations stay healthy and to improve in their health. There are fewer resources in many of these areas, and as a result, it is difficult to advance the health of the population. But maybe you could tell us a little bit more about some of the innovations that are happening at the Margarettville Hospital component of your operation.
Sure. That's actually a very exciting one for me personally. because being able to deliver services to a rural community is very important and very challenging for a lot of reasons. So two of the things that we're doing are I think, bring great value to the community. Number one, being able to bring adolescent psychiatric and behavioral health services to the population up there. Margaretville has the highest adolescent suicide rate in New York State. And I believe in Delaware County they have one sole provider. So what we're doing is, and again, through the cooperation and a grant that we've gotten from the state of New York, we're bringing those services to Roxbury School and to Margaretville School. So we'll actually have a clinician in school-based with a telemedicine unit that'll be able to help us reach those kids. We think that's tremendous. And I know we've got Tom O'Brien is the superintendent of the Roxbury Schools, and he's on the board of Margaretville Hospitals. And I'll tell you, it's a great partnership. So now we have a board member, a community member, obviously, and a school superintendent. So we think that's going to bring tremendous value. Number two, and this is a little more forward thinking, we don't have it down to a science yet, is bringing a telemedicine unit into an ambulance. So in Delaware County, if there was an accident, an event happening at a patient's home, and they're put into a rig, we can immediately have contact with WMC Health and those practitioners. So there's immediate attention. We're monitoring the patient. And because Margaretville is intention, the purpose of Margaretville is to treat and move on to a different level of care, basically triaging. So if we can triage that patient in the ambulance and either bring him to Kingston, if it's appropriate, bring him to Mid-Hudson Regional. We could also bring him down to a Good Samaritan Hospital down in Suffern or into the Valhalla campus, depending on the level of care. The care is immediate, consistent, and very effective.
That's wonderful, because certainly in many instances, time is of the essence in determining the outcome of that person's illness or injury, what have you. So that's good to hear.
Yeah, picture a stroke protocol where time is absolutely of the essence, hooking up with a neurologist and then determining whether to administer TPA or not.
Absolutely.
Very, very powerful.
Dave, we've touched on some of the technological advances and some of the other things in terms of bringing specialists and best practices. But considering the incredible speed of change in the hospital and the healthcare industry in general, and all the pressures, financial and otherwise, if you were to look 5 years or maybe 10 years down the line, how do you envision the hospital of the future? What does it look like?
Boy, I wish I was that. I was that smart, because it's moving so quickly now. It's hard to imagine where it's going to be in 10 years. But I think generally speaking, it's going to be outpatient focused. It's going to be focused on preventative care, on community collaborative efforts to keep people healthy, and really to help change the culture of a community. You know, keeping people healthy. If you look at any of us, the way we eat, the way we exercise, what are our values? I mean, what do we hold dear to us? And how do you move people away from fast foods? How do you move them away from sugars, carbohydrates, and how do you move them into clean eating and exercise programs and things that are help their mind?
And smoking cessation.
Right. Absolutely. But when that becomes a community-wide event and everybody is pulling together, I think you're going to see a change in the health of this community. So let me just go to Medical Village for a moment. In the Broadway campus, we're proposing a medical village. However, that's not going to happen until we consolidate the two hospitals to Mary's Avenue. So we're talking a number of years out. What we're trying to do right now is create a medical village, and to create it with a few partners in the community in an effort to start that process. How do you engage? And right now, the two groups we're talking to about engagement is the faith-based communities and the folks from O Positive. And think about what they both bring. O Positive wants to, through their festival in October, what they want to do is they want to bring together healthcare providers, musicians, and artists. Musicians and artists many times do not have the healthcare that they need. How do we do that? How do we accomplish that? Faith-based, in many of the faith-based communities, there's a profound need for healthcare.
Right.
But who better to be the navigators to that community than the leaders of those congregations?
Because they're already trusted and loved and part of the fabric. Yeah.
So when we start to work with them and we build some incentives, whether they be financial or otherwise, and we start to use our hospital as a gathering place for those groups, so they can start to work together and think together and maybe do some yoga or dance or exercise. When you start to do that, maybe we bring a farmer in to bring some produce in. When you start to do that, that'll organically grow, and by the time we're ready to do a medical village, we'll be well on our way.
Well, certainly that's been our priority as a health department. It's been our priority as a county. When the county executive said that his goal 8 years ago, was to make Ulster the healthiest county. What his view was, or his mission, really involved making health a priority in all of his policies. And, we certainly have taken up that cause in the health department. We've attempted to make sure that we connect with all partners in the community as well as we can, and to identify where the gaps in services are, where the needs are, where the predominant problems are in terms of the barriers, et cetera. So, we're all basically now thinking in alignment. In fact, the New York State Department of Health, as part of its Community Health Improvement Plan a few years ago, basically required that the hospitals with their community service plans and the health departments with their community health improvement plans collaborate and find out where are the synergies and where can we really exponentially increase the benefits to the community by combining our resources. So that certainly is something that we're very, very aware of.
Right. So you can see in 5 or 10 years, we're not a brick and mortar based operation. We're a collaborative partner with government, with community leaders, and in an effort to keep people healthy. I mean, how do we identify that when you look at the drivers in this community that affect health? You're talking about smoking, you're talking about obesity, you're talking about diabetes, hypertension. Very simple in concept to understand, but how do you change them?
Right, and then all the other factors that we always talk about a whole community approach, because you can't really take an individual or family out of the total context in which they live their lives. So we even talk about things like education, employment opportunities.
Right. Well, certainly, I think
to food.
Absolutely. Talking about education, and the rates are improving with high school graduation rates and college rates, et cetera. But, the Strive project, where I think was brilliant, where you brought the Ulster Community College campus to Kingston, literally within a block of the campus of Mary's Avenue and the former Kingston Hospital. So this is a way to train young people through the academic route to become nurses, to become direct health providers, care providers, which are certainly going to fill a tremendous need for us as we move forward in the future.
Right, and I think, as Dave was saying earlier, that, the hospital shifting from being like the healthcare provider of last resort to being in it much earlier in the process in terms of keeping people healthy in the first place, which is really where public health evolved to. I mean, public health was formerly taking care of people who were underserved or didn't have insurance and providing clinic. Now it's all about engaging every sector, every facet of the community, and helping people realize that we all have an important role to play in all of this.
We do, and it's really changing. I'll use myself as an example, being of Italian heritage. I grew up on pasta and bread. That's a staple of eating in an Italian family. How do you move away from that?
Mm-hmm. But the Mediterranean diet's also very healthy with more fruit and vegetables.
That's
correct. So
yes.
You have to present the whole picture here.
But it's trying to wean people off of that, that which is sort of detrimental to your health, and get into that clean and healthy eating.
Yeah. And it's also, we talk about that community in New Jersey where the longevity rates are much higher than average, and where the chronic disease rates are much lower. They sent public health researchers in there to find out. It's an Italian American community. I forget the name now, but they found out that it was social support.
It was social support.
Social support.
Yes.
Exactly, yes.
People taking care of each other, having each other's back, and all of that. Dave, we're all maybe too well aware of the changes in Congress going on with the Health Care Act and replace and repeal of Affordable Care Act. It may be too early to tell how it finally emerges from Congress, but I'm sure you've given a lot of thought to the what ifs.
Well, I do want to add one thing before Dave answers, because since the Affordable Care Act, we've had over 24,000 people in Ulster County become insured,
right.
Which was huge.
We've halved the number of uninsured in Ulster
Exactly.
County.
So, certainly you need to have the ability to pay your hospital bill if you need to be in the hospital. So, again, I didn't mean to interject, but
the Affordable Care Act has been kind of double-edged sword. Number one, more people have insurance. You're absolutely right, which is great. Some of the concern is that the out-of-pocket, the deductibles and co-insurance that these folks have to pay is beyond their means. So when they come into the hospital and the first $5,000 is their responsibility, unless they've got $5,000 in savings, the hospital doesn't get paid. So we need some balance in that. I think we have to right-size that piece of it. The insurance piece is good. As far, Vin, as how does the congressional, at least, piece of this look? Hard to tell. It's got to go through Senate. And then there's a trickle-down effect with New York State, because obviously anything that comes to New York State, the state then and Governor Cuomo is going to have to make a decision of how to fund hospitals. So it's got to go through a couple of filters before it hits us. I have a very simple philosophy on this. We can't afford to lose any funding that we need to treat the most vulnerable in our community.
Absolutely. And those are the folks, those are the folks that really, you don't treat them. I mean, sooner or later you do. It's a question of whether you do it now for less money or later for a whole heck of a lot more.
So we watch that very, very closely.
Right. So Dave, we're beginning to run out of time. So if listeners want to know more about Health Alliance, about the affiliation, about all the services you provide, where do they go for that information?
They can go to our Facebook page, certainly healthalliance.org, and certainly come to some of our events. Matter of fact, if they really have challenges, they can call me. I'd be happy to talk to them. And
absolutely.
Well, we could, Dave. This is all great stuff, and we could talk for hours on this.
In fact, I think we need to have Dave back.
We'll have to have you back.
Speak more.
And thank you so much for taking time out of your busy schedule and all of the great work you do.
Absolutely, thank you.
And that's about all the time we have for today, Dr. Smith. This has been great, and please tune in next week for more great information that you can use to keep yourself, your family, and your community healthy and strong with Healthy Ulster Radio. Bye-bye.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.